evaporates off, it takes heat to evaporate it. So when you allow the water to evaporate off of his body, it takes the heat away from his body, and that lowers his temperature. And so you want the water to evaporate off at a temperature which does not make him shiver. Okay. If he's shivering, you're defeating the purpose of what you're doing. It means now, when you shiver, you generate heat. Your muscles are contracting rapidly. And when muscles contract rapidly, you generate heat. When you run, you sweat. Okay? And so what you want out of the water to do is be at a temperature that doesn't allow him to shiver, and for the water to be able to evaporate. Let him play in the water. Okay. Throw it in his, why we call it sponging, because you'd use a sponge, soaks up the water, you put it on nice, cool, comfortable temperature for him, and as the water evaporates off, his temperature is going to go down. Give him a rubber duck, give him something inside the water floating, and it'll allow him to stay in the water for a while until you bring the temperature down. The major portion that you've got to concentrate on, though, if the fever is very high and it looks like he's going to have a fit, I mean, you can see him irritable, jittery, jumpy, then that type of thing, you want his head cooled.
Cooled. Okay. That brings us to the next question, and it's from Mr. Hussein in Lujalasi. And I guess many of our parents are concerned about different temperatures as it relates to different ages. And so his question is, what is the normal temperature for a child who's 4 years old?
It's the same. The temperature doesn't vary in human beings. We are made up of cells, and the cells have an optimum temperature of operation. And so the optimum temperature is usually 37 degrees, or approximately 98.4 degrees Fahrenheit.
Now, the next question is a little bit off of what we're discussing, but it is about a fever. And it's for one of these unique scenarios where parents hear about fevers and their concern is, I've read about rheumatic fever. Dr. Jabour, what about this? Am I being concerned about my child and rheumatic fever?
Rheumatic fever is actually a specific entity, it's a specific disease. And this is an example. We say we built perfectly, etc. But sometimes nature, God, whatever, does do things a little different. I don't want to say he makes a mistake. God does make mistakes. So for whatever reason, things will go a little bit haywire with the immune system. And in the case of rheumatic fever, what happens is that it's a particular organism that has invaded the body. And so it's usually Streptococcus or staph. In this particular case, strep is the usual organism, and a particular type of strep, but we won't go into that. And so when this organism invades the body then turns on its immune system, and it starts to produce the antibodies to go and kill the strep. Unfortunately, it makes a mistake. And in the process of producing these antibodies to attack the strep, it attacks the body itself, particularly the heart and the valves of the heart. And it affects blood vessels and other things as well. But the major thing about it is that it has a predilection for going towards things like the heart valves, and the mitral valve in particular is the most prone for it. And so these antibodies, in killing the Streptococcus, also damages the heart in the process. And so this condition, when it does that, is called rheumatic fever.
Okay. As I'm looking at the next question, which is from Melissa in Eccles, before I give you the question, it brings up the cultural environment, because the question she's asking, I've heard it from grandparents and the aunts and everything. And the question is there such a thing as a growing fever?
Short answer, no. No. What they usually mean is that the period of time when the child is most prone to the infections, because when he starts off, he has no ability to fight infections. His immune system hasn't recognized anything, hasn't produced any resistance of any kind. And so he's now building his immunity. And at this period of time, it's usually also when he's growing the most rapidly. And so when they'll see the child having a fever, and at the same time he's growing, and they notice, oh, well, he's grown rapidly over this period of time, but they can't find a cause for it. So human beings don't like not to have reasons for anything. So they find reasons. And one of the things is that they'll get a fever at this particular time, and it's also the time that he's growing, so they put 2 and 2 together and come up with 5. And say, okay, he's getting growing fever. Having said that, there's another thing that we should mention in relation to this, where pediatrics doesn't understand why, and that is something called growing pains, which is something that is acceptable, that at a certain point in time when the child is growing rapidly, especially the long bones, and they grow very quickly in periods. They don't grow steadily. Children don't grow steadily. They grow, stop, grow, stop. They're called growth spurts. Okay? So when they're in that growth spurt, the bones are really stretching very rapidly. And for some reason, it'll cause pain in the growth plates and then especially the long bones. And those are called growing pains, and they're well recognized as being a problem. But in terms of growing fever, per se, it usually means that at that point in time, the child is fighting a virus.
Okay. In the program, the first half of the program, you talked about antipyretics, and I want us to describe that because not every one of our viewers will know what an antipyretic is. And then the second part of the question I have, aspirin. We have generally walked away or moved away from utilizing aspirin in children. And I want you to comment on that. So the first part has to do with antipyretics.
Yeah. Okay. The word pyretic is the medical term for fever. Okay? So an antipyretics means anti-fever. Okay. So these are medications whose job is to lower the body's temperature. And they do them by various mechanisms. Some of them will act at the thermostatic mechanism. Some of them do it simply by introducing sweating. And so I'll get parents who come and say that the child is febrile and he's got a fever and he's really sweating. And they've given him ibuprofen or paracetamol and he's really sweating. That's because the drug's job is to make him sweat. Okay. That's what it's doing. It's making him sweat. And everybody knows that as an adult, if I get a really high fever and I'm sick with a virus, one of the things I'll do is to take a couple of paracetamol or a couple of ibuprofen and a hot cup of tea, and I'll climb into bed, cover myself up from neck to toe, because I'm shivering usually. And that's one of the mechanisms that the body does in terms of fighting the organism, is that you shiver and you feel cold. And people find it strange, he's got a fever, but he's shivering, But that's one of the mechanisms that the body's using to fight the infection. And so what I'll do, I'll just get on the thing, and I'll sweat like crazy. And then an hour or two later, you wake up and the fever is broken. The medications and my technology has lowered my body's temperature.
And then the second part of the question is, you mentioned that the key medications would be acetaminophen or paracetamol. Yeah. Similar drug, just two different names. But what about aspirin and its use in children?
Aspirin has been given a bad name.
Yes.
Okay, it really has been given a bad name. And that's just to do with the drug companies and the fact that they're producing medication. But in fact, aspirin is the gold standard for certain types of medications. These medications are called NSAIDs, NSAIDs. And that stands for non-steroidal anti-inflammatory drugs. And they all work similar to aspirin. And a lot of them are derivatives from the technology of aspirin. And aspirin, being one of the oldest drugs, has been around for ages, and it's cheap. It's very cheap. Drug companies don't like that. So one of the things that, unfortunately for aspirin, is that it has bad effects. All the NSAIDs can have effects on your stomach. And it will interfere with your stomach's defense mechanisms against acidity, and you can end up with stomach ulcers, etc. It can do this with any of the NSAIDs. Drug companies claim some are better than others. But aspirin per se, there's nothing wrong with aspirin, its use in children. And children tend to tolerate these type of medications better than adults. Now, the problem we have with aspirin, in pediatrics especially, is that there is a condition whereby with chickenpox, if you have chickenpox, there's an association with the chickenpox virus and the use of aspirin, and you can develop a condition that's called Ray's syndrome, which is a very serious and deadly disease that, as a consequence, you get increased brain damage, to put it simply.
Correct. All right. Now, our next question comes from Natasha in Monrepo, and what she's inquiring about is that your child has a fever and the child develops a febrile fit. What should the parent be doing?
Try hard not to panic, okay? Because if it's there's some criteria that we follow, okay, that defines a febrile fit. And this is a distinguishing from the more serious type of fits, which is the afebrile seizures or epilepsy, which is a disease. Again, epilepsy it means fits, but without a fever, and there are various causes of that, okay? So with a child who is between the age of 6 months and 6 years, that is not such a serious situation. Okay? As I said earlier on in the program, it's related to the irritability of the brain. Now, the criteria that we follow. 1, first of all, there must be a fever first. Okay. That is distinguish it from the afebrile or no fever fit. There must be a fit first. The child must be between the ages of 6 months and 6 years of age. It must be a full-blown fit and not a partial fit. And by a partial fit, I mean it must not be one arm jerking or one face twitching, something like that. It must be a full-blown convulsion. It looks terrible because the child is going to be rigid, straight, eyes roll up, jerking. It must be a full-blown fit. The fit must last less than 15 minutes. And the fit must not need any medication to stop it.
Okay.
Okay? Once it fits that 5 criteria, usually that is a true febrile fit. There's some additional criteria that, secondary characteristics. 1, there often is a family history of it. And it's nice when there's a family history, because then the parent would know that, well, they had a fit when they were a child, and they're perfectly okay, and they're fine, and they're not neurologically impaired in any way. And so that's quite helpful. Other criteria is that after the fit, when the child recovers from it, the child must go back to being completely normal. Okay. In other words, there's no residual paralysis or speech impediment or hearing or anything like that, okay? And once the fit fits those criteria, that type of fit will not cause a major problem, okay? They will grow up, become quite perfectly normal neurologically. They will tend to transmit it to their parents because it's often hereditary. And the 1/3 of children approximately are allowed to have one fit like that in their lives.
Okay. Since we were talking about what can pass from mother to child, it brings us to the next question, which is from Middle Road, which is Reshma's asking, and it goes back to rheumatic fever. Is there a gene associated with this that we are aware of, and does it pass from mother to child?
Yeah, there's a lot of medicine right now that is looking at things like genetic structure and specific genes or markers, as we call them, that are handed down, that can pass on, that can give you indications whether you have a predilection for something or the other. And so you have that type of situation.
Now the next.
Unfortunately, in Guyana, well, we don't have the technology to identify these markers.
Yeah. The next scenario, I'm sure almost every parent has gone through this. Your child is having a fever, and you've diligently measured out the medicine based upon the child's weight, and you've given the child the medicine, and he or she promptly spits it out or vomits it out, and it's 2 o'clock in the morning, and the mother is about to cry with the child. What does she do? Or is already crying. What does she do at that time?
Or it depends on how much vomiting the child has done. 1, usually most of these medications have a color. If the child has vomited and you look in the vomitus and you've seen whether the color of the medicine, paracetamol is reddish, etc. Yes. Ibuprofen is orange in color most of the time, unless it's Advil, it's grape flavored. If you see some of that inside, then that would be an indication that he hasn't kept down enough of the medication. That would be an indication to give him another dose. If you're not sure, okay, then you can wait, because usually ibuprofen will take 20 to 30 minutes to act. Usually paracetamol takes about 45 minutes to an hour to act. You can wait for an hour, and if nothing has happened and the child's temperature is still the same, you can do one of 2 things. You can either give the second medication, which if you've given paracetamol, give ibuprofen, and vice versa, or you can repeat the dose of the medication an hour after. Okay. And that double dose with such a close space of time will not be harmful to the child.
Okay. Now, what about the role of suppositories in children? I mean, is there an age group, or we generally don't want parents to use it? What would you be saying to your parents?
Depends on which country you live in. If you live in France, that is the ideal way to give medication. In France, they use mainly suppositories for giving medication to children. The only difference with it is the route to which you're giving the medication. It's absorbed just as well from the rectum as it is if you give them to drink and it goes into the stomach. And so, especially for a child who's going to be vomiting and vomiting up, or a child who's spitting it out and doesn't want to, then the suppository route is by far an excellent route to give the medication, and it will be just as effective.
And you follow the instructions that come with it as per well. The next question, which is from Sam in Diamond, it deals with an issue that has come up recently with a vector, this mosquito-borne virus, chikungunya. I hope I'm pronouncing it right.
Yeah, it's chikungunya.
But his question is, my child has chikungunya and the fever is not breaking. I think we need to break that up into, we'll have a few moments later where we will discuss chikungunya.
Okay.
But let's break that into two questions. So you've got this fever in a child, and the fever is not breaking. Let's deal with that part first. What is the expected time period after you've given the medicines, and what does fever not breaking imply?
What people don't realize, chikungunya is a virus. It behaves like the influenza virus. It's a flu virus, except it's got some characteristic symptoms, just like chickenpox is a virus. And so chickenpox, you recognize it comes out in a specific type of spots and it runs a particular course, etc. Chikungunya is exactly the same. And so the thing about chikungunya, it's quite a serious virus, just like dengue, etc., where it really puts the human body under a great deal of stress. And it will affect a multitude of the organs in your body, especially things like your joints, etc., and your skin. And so you'll get skin rashes, you'll get skin joint involvement, you'll get muscle aches and pains, you'll get bad headache, you'll get eye pain. And above all, you're as weak as a kitten. You cannot move. It hurts to walk. My daughter just is now getting over it. It was really rough on her, 17-year-old. And so what you're going to find is that in a person with chikungunya, the body, because it's such a strong virus and it has such a strong effect on the body, that the body is going to need all the help it can get to fight it. And so one of the things it'll do is give you a high temperature and raise the temperature and keep it there for a while, okay? And so you want to try to bring the temperature down, but not a lot. The more important thing of the antipyretic there is that it has a secondary effect, and that is pain relief. And the main purpose of this type of medication is so that you feel a little bit better, that you don't feel as lousy, and you can move around a little bit, and you're willing to take a bit of fluid. Because when you feel as bad as you do with something like chikungunya and dengue, you don't want to move, you don't want to do anything. Mm-hmm. And so you need the supportive fluids, and so taking things like the antipyretics will help that as well, so that they'll tend to take the fluids. But in terms of trying to bring the temperature down a lot, you really shouldn't. You should give the body a chance. Yeah. If the child, as I said, is irritable and is showing signs that he might have a febrile convulsion, then that would be a criterion. Okay, let's give him a little bit extra medication. And so sometimes we'll use combinations. We use a combination of both the paracetamol and the ibuprofen or the NSAID type medications, of which there are a few of them. Aspirin, we don't tend to use aspirin with chikungunya because it's hard to distinguish from dengue, and dengue will lower your platelet count and make you bleed. And so you don't want to use aspirin in a situation like that. Yeah.
Now, I'm certain that many of our viewers have a lot more questions on chikungunya. And both you and I spoke to the Chief Medical Officer, Dr. Shamdev Prasad, earlier. Yeah. And we will come back a little bit later in the program to spend a few minutes on that. The next question from Wanda in Kitty talks about fever in a child with asthma. And Dr. Jabour will be coming back in a later program to specifically discuss with us asthma in children. But let's deal with this particular question, which is a parent has a child, known asthma, and the child now has a fever.
Deal with that type of scenario. Asthma by itself has particular symptoms and criteria, and most of those don't need a fever. Because of the nature of the disease, you tend to accumulate mucus and secretions within the lungs. If it's been there long-standing enough and the child has not been treated and is having a lot of difficulty with breathing because of the blocked up lungs, the mucus that's there has been sitting there for a while and can be stagnant. And if it's stagnant, it's a good breeding ground for bacteria. And so the clue will be that he's having his asthmatic attack for a few days, he's not getting better, you're giving him his asthma medications, and they don't seem to be working very well. And then he starts to develop a fever. That would be the point in time at which you'd want to introduce an antibiotic. Okay? Usually though in asthmatics, if they're having a straightforward, simple asthmatic attack secondary to a virus, with little or no fever, you usually don't have to use an antibiotic.
Okay. Now, in terms of lowering the temperature, do we want the parent to use more than one medication, stick to one medication, what is your recommendation to the parents?
Ask the child.
Okay.
He'll tell you by his body language. He'll tell you, he'll show you whether he needs it or not.
Okay.
If you've given him and he's not responding and it's 2 o'clock in the morning and his fever is sky high, I'd give him the second antibiotic
Okay.
in addition.
Now, we'll take a moment now and sort of speak about chikungunya. You and I were both speaking to the Chief Medical Officer earlier today, and he was lamenting about a few things. And I think I want you to discuss two things in particular. Make our viewers aware that this mosquito doesn't really travel too far. And so we need to recognize that the persons who are getting the infection have become carriers. So explain to our viewers those two aspects in your bigger discussion on chikungunya.
He's done an excellent job up to now of saying what the problem is. Okay? As I said before, chikungunya is a virus, like dengue, etc. The only difference between chikungunya and influenza is that influenza is an airborne virus. And so it can have very similar symptoms to chikungunya, in fact, except that with the influenza virus, everybody gets it. You only have to be near the person and you'll pick it up. Chikungunya is spread by a mosquito. We call it a vector. Vector just means the way it's transmitted. And you have the vector along the in our coastline. And so the mosquito bites in the day as well. It doesn't only bite at night. Now, in order for the mosquito to give chikungunya to someone, he has got to bite someone who has chikungunya virus. And then the virus goes into the mosquito, it multiplies. And then the next person that the mosquito bites, he'll put that virus into that system, into the person. And so if you've got somebody in your household who has got, you've recognized has got chikungunya, or you suspect has got chikungunya, you don't want that person loose in your household. You don't want them loose in the public. You don't want them going everywhere, because they're going to spread it. That's the way it's spread. I mean, ideally, get rid of the vector. If we could get rid of the mosquito, we won't have chikungunya. There'd be no problem whatsoever. That's not the real world. We're not getting rid of mosquitoes. We haven't done it since 1945 when we got rid of malaria. So as a means now of trying to control it, each individual has got to realize that if he's got symptoms or she has got symptoms of chikungunya or your child has got chikungunya, you got to prevent the mosquito from biting him. That's one. So he should be sleeping with a netting around him. Wherever he is, he should be in a situation where you're sure that mosquitoes are not around that can bite him and thereby transmit it. And two, if you don't go out into the community where the mosquito is prevalent and these mosquitoes bite in the day, and you go back to work, you know, you're not quite well, you're still sick, you still got symptoms, but you are now the host. You're the person who is going to give everybody else chikungunya. And so going out into the public, going to public functions, you know, you don't do that. You stay home, you're sick, you allow your body to do its job, it will fight the chikungunya, it's not going to kill you. You're going to be sick and you think you're dying, but you're not going to die in most cases unless you're a very tiny child or a very old person. Most healthy people will fight chikungunya without a problem. It can have some long-term effects, but not life-threatening. Yeah. And so it behoves you as an individual to be responsible and realize you don't want to spread this disease. You don't want to spread it to your family and your friends and your co-workers, etc. Stay home.
I think that's the key message that Dr. Shamdev Prasad wanted us to get across to the viewers, is that the person who now has chikungunya is carrying the virus, and that is the way the mosquito is going to spread the virus, by biting that person and then traveling a relatively short distance to your close friends and family.
The actual range of most mosquitoes is a mile. It's 1 mile.
Correct.
You know, I like the outdoors and hunting and fishing. If I'm going to the interior where there's malaria and so forth, I make sure that if I'm staying outdoors, and I think I stay at least a mile from wherever there's people encamped, because that way I can't get malaria, okay, or chikungunya.
Well, we're coming down to the tail end of the program, and I'll deal with the last two questions. One question which was asked earlier, we have addressed, and somebody asked, can I use a suppository in fever? And we have addressed that. Yes, it is perfectly reasonable to use that, and it's a route of choice in some countries, and especially if you have a child who is not willing to take things by mouth, use the appropriate dose. This person is asking a little bit more of a technical question, and it's Ms. Prasad from Berbice. And he's asking, can a prolonged fever damage the hypothalamus? I think before we're going to answer that, we'll have to explain to the regular viewers where the hypothalamus is.
The hypothalamus is, it's at the bottom of the brain. There's a little, tiny little gland that's hanging down at the bottom of the brain called the pituitary gland. And quite close to that is the part of the brain that's called the hypothalamus. And it has a lot of functions. And even though it's very, very tiny, it does a lot of things. And it's involved in temperature control and things like that.
So quickly,
but a fever by itself will not damage it. Correct. The only time a fever is capable of damaging parts of your body is if it goes too high. And there are conditions and circumstances in which the temperature will go over 105. And that's something we should mention in terms of, as we're here. The minute you hit 105 degrees, the human cell cannot function properly, okay? And as you start to go over that, it can't function, it'll work, you'll die. And that's 105 and above, you're going to start to think of ice baths and things like that to put them in. Below that, as a simple criteria, if you have a thermometer that's accurate, the ranges are between less than 101 degrees. 101 degree down is a mild temperature. 100 and down. Between 101 and 102 is moderate temperature. 103 and 104, high temperature. Okay? So once you've got those ranges in mind, people get very, very worried if they see a temperature of, the child's temperature is 102. And I say, great. It means his immune system is working perfectly. Okay? As long as he's fine and he's okay otherwise. And so in terms of temperatures, those are guidelines. You know what is my best guideline? The backs of your hands. That's where most of your temperature sensors are on your hand, in your body, is on the backs of the hand. And that's why you see us, when you're touching a person's body, you use the back of your hand to touch the fever. And you'll know, you put your hand on, it's warm. You put your hand on another child, you can roast an egg. Okay? It's very, very hot. Now, and that's all you need to know, that this is a very hot temperature, or no, this is a mild temperature. And the other criteria you're using, remember what I said? Look at the child. Okay. If he's ignoring it, you ignore it.
We've got about a minute and a half more, and I'd like just one quick answer to this question. When should the parent bring the child to the emergency room with a fever?
If you have looked at the program, you should be able to answer that now. You can use it as a guideline. It is what the child is doing, okay? If you've got a child that you're giving fever medicine to, and the fever drops quite nicely after half an hour to an hour, and then he plays normally and he's okay, and then 4 to 6 hours later the fever goes back up again, and he's a little croaky, and you give him fever medicine and he's okay, then fine. That type of child, just wait. If you've got a child who you're giving fever medicine, you've given both medications, and he's still croaky, it's not moving, the temperature is dropping slightly, and he's not eating, he doesn't want to drink, and you can see that he's unwell, your instincts will guide you as a parent. He's unwell, bring him to me.
Well, I think we're about at the end of the program with time. I'd like to thank our viewers. I'm sure many of you have questions. Please remember, you can continue to interact with us through Facebook, WhatsApp, and those messages. We won't be answering you directly, but we'll follow up with you on our website. Dr. Jabour, at this point in time, thank you very, very much.
You're welcome.
And we look forward.
I hope it was helpful.
It was certainly helpful, and we look forward to seeing you in a few weeks when we'll be discussing asthma in children. So again, my viewers and listeners, thank you very, very much for joining us this afternoon, and have a good afternoon. Bye-bye.
What price do you put on your life? In emergencies, when you need to get help fast, the Berbice Bridge gives you the assurance that you can make it every hour, every day. And when it's a question of traveling safely, the people at Berbice Bridge take pride in their maintenance program that keeps the bridge trouble-free and very safe. Now your friends and family in North America can visit more often. The Berbice Bridge, saving time and money, saving lives.
International Pharmaceutical Agency. When we started out, we were thinking of supplying everything medical. That's what we do now. General medicines, yes, along with equipment for the dentist, eye specialist, ear, nose and throat specialist, gynecologist, heart specialist, pediatrician, caregivers, and everything for hospitals big and small. So it's no surprise that today IPA is the leading supplier in the medical profession. International Pharmaceutical Agency. The nation's health is our concern.
Introducing the new Lotto Super 6. You knew it as Lotto before. The jackpot with the biggest cash payout. Now easier than ever to win and win more often. For only $200, you can pick any 6 numbers from 1 to 28 for your chance to win the jackpot. Get 6 numbers and the jackpot is yours. You can win if you match 5 numbers plus the bonus ball. Match 5 numbers, match 4 numbers, match 3 plus the bonus ball, or match the letter and get a free ticket. Still drawing twice weekly. Your chances of winning are even better with the new Super 6. Remember, a ticket a day could make you rich today.